Hey folks. So let's talk about how to survive 24-hour call. So in some surgery programs, you have 24-hour call, and some you have just night call or nights. But in my program, there's 24-hour call, and I know it's still decently common around the country to have 24-hour call. It's definitely tough. It's definitely a tough experience. It's not ideal, but it is what it is. And really, the way you go about call, has a big impact on how rested you are at the end. So the first thing you have to do, you have to know where the call room is, and you have to find it, and you have to set up camp in the call room. Maybe like 2 weeks ago, I started the shift at like 6 a.m., just a regular shift, and there was someone else that was on at 24. And I asked her, like, do you know where the call room is? She was like, I don't know. I was like, can I show you? She's like, no, I have to pre-round. Like, I have to pre-chart. We're about to round soon. Next day, I show up, like, did you find the call room? She's like, no, I didn't want to ask my senior. I ended up just sleeping in a chair in the resident room in, like, the regular, GME office where there's just a bunch of computers. To me, it's, like, mind-boggling. We all got emails in the beginning of the year, like, where the call room is, where the codes, where the pantry is for, like, snacks. So you got to find all that stuff, set up camp, know where it is. And, so you set up in the call room. You got to right away grab like 3-4 pillows, like 2-3 blankets, and you got to just like lay in the bed, like relax. I start my shift relaxed because I know those consults are going to come. If you think there's a night that you're never going to get consults, like I don't think that's going to happen. Even though consistently I've gotten at least 3, 4, maybe 5 hours of sleep every 24-hour shift that I've had because I set it up correctly. So you have to set up your microphone dictation, M-Modal, whatever you use, Dragon. You got to set that up right away. You don't have time to be typing. You're on a call shift, okay? You got to set up order sets. Kid comes in with appendicitis, there's an order set. NPO, maintenance IV fluid, Zosyn, cholecystectomy, LFTs. There's order sets. You got to set those order sets up. If you're putting in every order individually, I mean, just an extra 5 minutes for each patient, which stacks up to an extra hour probably at the end of the shift. So it's a little waste of time. The other thing is you need to have your EMR on your phone if you can. If not, if you're at some hospital that has just CPRS or something, then obviously I don't know if you can do that, but Epic, I think Athena, whatever, those EMRs, they can be on the phone. If you have an iPhone, you can even put orders through Epic. So that's like super critical because maybe half or maybe even up to 75% of the messages that you get are things that you can answer with just a few words. Like, oh, this patient, this PICC line needs to come out. And then they're like, oh, can we wait? It's like, no, it's the source of infection. Just, the order's already in, just do it. So you don't want to be getting up out of bed because you got a page and you have to go now, log into your computer, turn the lights on, and turns out the page is, can the patient have Tylenol, when you could have probably ordered it on your phone. Or you could check on your phone that you already put in the PRN meds, and you can just tell the nurse, please check the PRN orders. So the other thing is with this messaging thing, if you have Epic, whatever EMR you have, if there's an option to put busy, do not disturb, you should put that. And then you should write your pager number and write something along the lines of only page for urgent issues, for non-urgent issues message. And you should check your messages every like 2 hours or hour, but basically non-urgent things where they say like, oh, by the way, like this patient is discharging in 2 days and you're getting a message about it at 2 a.m. for some reason, and they're wondering if they're going to go home with oxycodone. Like you don't need to respond to that at 2 a.m. So you should make it clear. The problem is, and a lot of people get mad at the nursing staff. Like nursing staff, they're shift workers. They start their shift at 7 p.m. to 7 a.m. and the opposite. So they don't know that you're on for 24 hours. Maybe some of them do and some of them don't care, maybe, but I think most of them, and then even consults that you get, they don't know that you're on for 24 hours. So, I mean, one time I got a guy calling me and said, like, oh, I just want to talk about this patient who's coming in 2 weeks for like an elective procedure. Like, and I was like, all right, man, like I'm busy right now. Send me a message like during the day, Epic chat me during the day, and I'll get back to you. So people just don't know that you're on 24-hour call. I mean, it's unfortunate there's no communication for that, but you basically have to put it in, automatic response or whatever, like, page if urgent. If not, like, I'll get back to you, in whatever, more than 30 minutes, less than 30 minutes. That's what I've seen. The other thing, go to sleep. I don't understand what's stopping you from going to sleep. Like, every call shift I go to, I take over from the previous 24 person. I say, hey, like, do you sleep? They're like, no, I couldn't sleep. And then I always end up sleeping. I don't understand why people don't sleep. As soon as you get there, like my call shift started at 6 a.m. As soon as I get there, I mean, I'm already in bed. Okay, I have my pager on. I have my Epic on. I'm like looking. I'm checking vitals of the most urgent patients, like the watchers. And then you should already be in like sleep mode, because this is your 24 hours. You gotta sleep whenever you can. So if 2 p.m. comes along and you don't have any consults, you should take a nap. 8 p.m. you should be in bed trying to sleep. Okay. Now, how do you set yourself up to sleep successfully without missing consults? Your phone, friends, family, whatever, non-urgent messages, they should be on like do not disturb. You should only have like your attendings and your seniors in a way, in a setting that lets them like get the phone call across, even though you have like the do not disturb setting on. My phone has that option. And then my pager's on loud, and then we have, depending on the hospital I'm in, we have like different messaging apps. Like there's one called AMS Connect. There's another one called MH Cure. You can set those up to be on loud. So I'm basically asleep. I don't even need to put on my alarm. I know I'm going to get woken up by a page. Typically, I sleep like 8 to 12 maybe, and then I'll get woken up at like 12:30 by a page. Okay, I'll go see it. I'll go see that consult. Sometimes I sleep from midnight to 3 a.m. and then I get a page and I get woken up. But if you're not going to sleep because you think, oh, I'm going to get a consult, I have to stay up, like that doesn't make any sense. The consult should wake you up. We also have a phone in the call room. I mean, every call room I've seen, every hospital has a phone. You put that in your Epic message. This is the phone number for the call room. When I get a consult, sometimes they just call me directly. They wake me up, ring, 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 and Cala Gen Surge, and then whatever. And then they start telling you about the patient, and you think, oh well, I need to be up, I need to be chipper, whatever. They start telling you about the patient, they never give you an MRN. So the first thing you got to do, which gives you time to wake up, is say, can I get an MRN? Type in MRN, you look at the chart. All right, can you tell me about the patient now? Here's another thing that people don't do. I mean, it's wild. Okay. You need to stack non-urgent consults. My attending doesn't want to be woken up at 12:30 a.m. and then again at 2:30 a.m. when they could just be woken up once at 2:30 a.m. So if I have, an abscess, non-toxic, non-septic patient, vital signs normal, that I know is going to go for an IND at 9 a.m., I don't need to wake up my attending at midnight or at 2 a.m. to tell them about that, okay? If I have a patient with appendicitis who's non-toxic, I can do all the stuff. I can start the antibiotics. I don't need to wake up my attending at 3 a.m. and tell them that. But if there's like 3 consults now, okay, I need to let them know. Or 2 consults who are semi-urgent, I need to let them know. So stack non-urgent consults, and that saves you time too, because when the ED is calling you, you can tell them, hey, is there anyone else, that you're about to call me about? Because I can see them. And yeah, I mean, that's my advice on how to survive a 24-hour call.